So we're going to get started here with our clean air panel. Hello to everybody on Zoom. We have a lot of participants on Zoom here today. We have some participants in person. And I want to introduce everybody. So welcome to the clean air panel. I want to first thank our panelists here for coming. I'll introduce them a little more pretty soon. So I want to start out by talking a bit about the mission of our organization, Mass Together Colorado. So we're a branch of Mass Together America, which I'm going to put up on the screen, is a national organization promoting layered protection for toxins in the air. And so things like masks, air filters, things that can keep you safe. So we all hear a lot of politicians and media outlets these days equating things like masks with not living your life. We're here to communicate that it's not all or nothing. Masks are just one helpful tool among many other tools that we'll talk about today, like air cleaners, for instance, air quality monitors, that if used properly can help you live your life to the fullest. So for instance, wearing a well-fitting mask on an airplane can get you to your vacation without getting a cold, and putting an air filter in your home can help filter toxins out of the air, like wildfires. So quick, we're going to introduce the introduction of our organizing team. So I'm Maria. I joined the board of Mass Together America last year. And then we have Susan here. If Susan can raise your hand, and I'm going to show Susan on the Zoom as well. There we go. So Susan and I put this together as the local chapter back in January. We have a tool table over here, and I'm going to turn the computer around a little bit. We're going to show a lot of tools today, and here is Mitch, our tools expert, who has prior military experience working with gas masks and things that can help protect you from lots of different airborne pollutants. They have a machine called a port account, which can test whether a mask fits your face, which is very important for seeing if it protects you well. You can see this after the event outside. So, and we have now our panelists. So turning to the panelists, we have Fiona, who is a public health expert who has worked in public health for many years. We have, so she's also on the organizing team. And we also have Jose Luis Jimenez, Dr. Jose Jimenez, who works at Boulder in aerosol research. That's correct. And we finally have our panelists on Zoom. So Stephanie Williams here is a community activist who does a lot of community work, and she's going to give her perspective as well. So I'm going to pin her in a little bit after I'm done with my introductory remarks here. Okay, so thank you to the panelists for all coming. I just want to say we are a very clean air event. We have doors open and windows open, and it is very clean air in here, and we'll talk about how we measure that in a little bit as well. And we'll spend about 40 minutes on our Q&A with the panelists, and then open it up to the audience for questions as well. So if the Zoom audience wants to put questions in the chat, that's totally fine, and we will see them as they come. We see people saying hello. And so hello to everybody from Oregon and everywhere else that you're coming. This is a very exciting event. Okay, so what we're going to do is we're going to ask questions that address three main topics. One, what the air is doing to us. Two, why is the study not addressing clean air like we do for clean water, right? We know how to clean our water. What do we need to do for our air? And three, how can we make sure we're breathing clean air ourselves in the meantime before, we have clean air measures in place. So, so I've already introduced our panelists a little bit, but I want to start out with little introductions from the panelists. So if you could each introduce yourself, I'm going to pass around this mic for in person. And why don't we just have Stephanie introduce herself first, though? So Stephanie, if you could give a quick introduction of who you are and why you wanted to be on this panel, that would be great.
Sure. Hi, guys. My name is Stephanie Williams. I have been advocating for clean air since the start of 2020, and I just wanted to join this panel so that we could clear up some misconceptions or misunderstandings about clean air. So I'm really excited to be here. Thanks.
Thank you very much. So now we'll have Jose. So if you want to speak in the mic.
So I'm a professor and aerosol researcher and study generally measure air pollution of different types. And I had really not worked on viruses until the COVID pandemic when I I got trained with a group of experts and ended up spending most of my time for several years on that topic. And now a lot of my work is now on air cleaners and trying to understand what they do and which are the good ones and things like that.
And I'm Fiona Gao. I have a bachelor's in civil engineering and a master's in occupational safety and environmental science. And I worked for 10 to 15 years in occupational safety in hospitals and in public health. So lots of expertise on how these tools that we have are used in workplaces and how we can use them in our homes.
Thank you. Okay, so let's get to the questions on the science here. So first on what's in the air and what's it doing to us. So I want to start with Jose. So can you tell us a bit about what your aerosol research is about? What has it shown about how, what are the most common toxins, viruses, pollutants, or allergens that can be found in the air these days and how they affect our health? Quick summary.
Well, trying to be brief, we have on one side we have kind of chemical pollution, so aerosols that are made of chemicals, of organic materials, of salts, of dust, of black carbon that are coming from cars, from trucks, from reactions in the atmosphere, and that's what we often call PM 2.5, and it's there all the time, but we can really see it when there is a wildfire. Now it's 10 times larger and it's kind of obvious, and we get more worried, but it's there all the time at a lower level in places like Denver, and the more you are. Then there is the pathogens, so things like COVID or tuberculosis or measles. And, and I think we're all pretty familiar with those. You inhale them, you can develop the disease, and then you can give it to other people. Then there are things like allergens or certain chemicals that are especially toxic. And anyway, I think people are generally familiar with those. I will take more time.
Sure, thanks. Okay. Well, I have another follow-up question for you because you're an expert. I want to start out with the facts. Okay. So, what are some of the highest risk places right now in terms of breathing air that can pose a long-term risk? Like, what do we have to worry about as people, right?
Oh, that's the question that I spend a lot of time thinking about. I mean, and again, I would divide it in between kind of chemical pollutants and more biological risks, and also it depends for whom, right? It's like there are people who are very sensitive to chemical pollution if they have emphysema or things like that, or there are other people who have taking immunosuppressants and whatever, and they have to care much the biological effects. But I would say, I mean, certainly wildfires are the most obvious, or anytime anything is burning, there is a lot of particulate material. That's a risk. Now, sometimes that's self-inflicted. Many times people burn incense in their house. Like, oh, turn that thing off. But you go into a shop and the shop is full of smoke and they sell you all these candles. Like, oh, you know what you're doing to yourself. So I think there is a bit of ignorance in society still about, like we recognize the wildfires, but sometimes we do it to ourselves and we don't notice. And then the other thing is that talking to epidemiologists, what they tell us is 10 days breathing 1 unit kind of has similar effect on you than 1 day breathing 10 units. So basically, there's this chronic exposure to pollution. This is a cool day, I live in Denver, but over the course of the year, that may be as bad for you as wildfires are, So doing things to clean the air in your house when it's easy or whatever, it's important. The other thing is about how not to get diseases. So then what I do myself and I feel this tension between kind of being a warrior and knowing about all these tools, and at the same time, my family is like, don't become a pain again. And when do we really need to? So it's like I'm always all the time, when do I really need to worry? So one thing I always carry around my AirNet, like I see most people in this room, and use that to evaluate. So right now mine is reading 640, similar to the others. If this was reading 1,000 or 2,000, I would put on my masks. But it seems that we have the windows open. It's not there's not a lot of people here, so this is not a high risk situation. Also, I'm not gonna be here for a long time, but for example, I just came back from Europe in these really long flights and whatever, and I wore I wore the 95 masks the whole time. And so if I go into a hospital where there may be a lot of people who are maybe sick, especially at the emergency room or something like that, or people who are more sensitive, or things like that. I could go on and on, but I try to make a judgment. So I always have masks with me, and sometimes I go into a bar that looks okay, and then I start to see the number five, and I go, my masks, and everybody looks at me, what's going on?
That's good.
Anyway, so that type of thing, we could talk in more detail about that.
Thanks. I'm gonna grab the mic here. So, okay, thank you, Jose. So, we heard about, what is in the air and, what his research showed. Asked Fiona a question. So how much does aerosol spread matter for viruses like COVID, flu, because you're the public health expert, right? And the measles, right, which is going around now in Colorado. We hear a lot about washing your hands to prevent the spread of disease. What about wearing masks for cleaning the air? How important is each for different viruses?
So I'm just going to start by saying it's very important, right? When you're treating a measles patient in a hospital, or a chickenpox patient, or a COVID patient, you're wearing an N95 that you've been fit tested to. You've proven your vaccination. You wash your hands. You have clean air provided to the patient care room, and it's constantly being cleaned out. If it's a measles patient, it's going to be in a negative airflow room. It's really the main way that many viruses spread from person to person. Not all viruses. Some viruses don't spread from person to person through the air at all. And that's where it can be tricky, right? Where there are some viruses that are in the middle, that they spread a little bit through the air and a little bit person to person through touch. Flu is more like that. COVID is more airborne, and measles is probably the most airborne, and it's one of the reasons it's the most contagious. And the reason there's a difference is because all of these viruses work a little bit differently. They have different characteristics. Some are enveloped, some require a really small dose to be infectious. And these things all determine whether or not the virus can spread through the air. So a virus like Mpox, monkeypox, we've seen that it historically was considered airborne, but now we know it is very person-to-person spread through bodily contact and sexual interactions as well, through that bodily fluid contact, but it also has an airborne component. So measles, very airborne. COVID, rather airborne. Flu, airborne. Some more of an issue with hand washing, or your kids sneezing in your face. That's a good way to get the flu. But all of these can spread through the air, and time and distance matters, but they do have airborne components.
All right, thanks. So we're going to turn it to Stephanie, our online panelist here. So Stephanie, you work directly with the community a lot, especially with disabled people. You've done a lot of work with that. What are you seeing in terms of how these airborne hazards that we've mentioned are affecting the people that you work with? So for instance, Jose and his answer depends on your condition somehow. What would you say about that?
So people with disabilities are even more at risk than the general population for complications from viruses or from the pollutants that we have in the air. We're more likely to experience negative effects than the general population. Anybody can experience the negative effects, but unfortunately, people in the disability community are most likely to experience those effects. And what's even more sorry, I couldn't think of the word. What's more unfortunate about this is that people with disabilities often are exposed at a higher rate to pollutants than the general population. And that's because we can't always have the mobility to get out of that situation where the air isn't that clean.
All right, thank you. Okay, so yeah, it's important to consider who we are as well, right? And so just one more question about like what's in the air and what's it doing to us. So Fiona, as a public health expert, what kind of long-term impacts can today's airborne viruses have on the body in general? So we talked about, disabled people are at higher risk, but just generally, like, what does wildfire smoke do to us?
That is a great question. All of these particles in the air and viruses that are transmitted in the airborne way have the most common ability is to damage your lungs. So if you get lung damage, you can end up with asthma, which can affect you long term. We know that if you get RSV as an infant, you're more likely to have childhood asthma, which is the leading cause of disability in children and the leading cause of absenteeism in children. So these viruses can affect your lungs. They can affect your lungs long term. There's very little recovery from asthma and from lung damage. Our lung tissue doesn't regenerate well. So that's true of wildfire, pollutants, and smoke, but we do have some ability to remove pollutants from our lungs, but it's not just lung damage. It can also cause cardiovascular problems. So we know that, for example, there are more heart attacks and strokes and things after you've had COVID. We know it increases your risk for 6 to 8 months at a minimum, but they've also shown that it can continue even longer than that. And we know that with measles, if you have a bad case of measles, you can have long-term disability from things like deafness and hearing loss. Measles and COVID and flu can all still kill you. And all of these things too can diminish your quality of life and your independence if you are someone who struggles with independence as well.
Saying that as somebody who has asthma myself and deals with wildfire smoke, it's very true. I can say from first-hand experience. Anyway, the second part of our questions is, why is society not addressing clean air? So again, starting with you, sorry. So why isn't public health talking about clean air very much in public communications? I haven't heard a lot about it from the official channels. Can you comment on your experience working in public health and how anything changed?
I think to start with, the reality of public health is that we spent 45 years addressing sexual health problems as a priority, and then we moved to vaccines as our priority. And most people who enter public health have a background in biology and sociology as a result of those things, because those are really important backgrounds. Aerosol science is very difficult, and I say this as someone who had to take some aerosol classes in my university degree. It's not a natural progression to go from sociology to aerosol science, and I think there's just not as much knowledge, and I think that's changing as we've been through the pandemic and we deal with wildfire smoke more, but it has taken time. The other thing is that clean air on a small and local level is very manageable. And very changeable. But at a systemic level, trying to get clean air to every school child in America is a big, instrumental, massive structural change. And big structural change takes time.
That makes sense. Thank you. That makes a lot of sense, actually. That change is just slow, right? Okay, so on this topic, so to Jose, so how would you compare the importance of clean air to the importance of filtering like bacteria out of our water or heavy metals out of our water? Is it a good comparison in your opinion, or is it, can you comment on that?
So it is a good comparison. It's something that we have to use and that can get us sick and that can be cleaned, and then we avoid those consequences. So in that sense, it's similar. I would say water is probably more important because it delivers more, I think, in terms of the total consequences, and that's why we address this first as a society. I think also because it's more obvious, right? You drink water versus you breathe the air, maybe you got it there, maybe you got it somewhere else. One thing on this general topic is like we say, why doesn't society address this? And I spend a lot of time thinking about this. And I mean, the current political moment is also an interesting background. It's like society is not monolithic, right? If society decided this is a problem and did all it could to solve it, we would be in a better place. But in reality, there are forces in society that push in different directions, and some forces, want to make money out of their hospitals or their whatever, and that matters more to them than protecting the health of people. So I think it's always a fight. Any of these things like clean water, like clean air, come with a fight. I think we're at the beginning of the fight for clean air. And I think it's going to take a generation, and it's going to take people like those of you in this room and in this Zoom to keep pushing, not forget about it, right? I mean, if we had this meeting during the pandemic, I had webinars where I had 2,000 people and whatever, and now we're 20 here. But it's very important that we keep going, and that we keep working on it.
That's a great answer. Thank you. So, okay, going back to Fiona here. So we all, we mentioned the pandemic a couple of times, right? Because, in 2020, 2021, we'd have 2,000 people watching a clean air panel. So also on, masks, we're Mask Together Colorado. We all wore masks in 2020 and 2021 to help mitigate the airborne spread of COVID. That also worked for other viruses, right? But then the COVID vaccines came out, those mandates were lifted, citing 95% vaccine efficacy. Can you comment on the current effectiveness on the vaccines and their safety and our access to boosters?
That is not a simple question to answer, but I will do my best. So I like to remind people whenever they mention the 95% efficacy of the vaccines, that those vaccines were tested when there was universal masking. So that was 95% efficacy with universal masking, not perfect masking, but masking. So we never really did a continued test, and then we had new variants, and that changes things. The reality is that the vaccine remains incredibly effective at keeping people from having severe consequences from COVID. There's still tons of COVID around, but people are not ending up on a ventilator in the hospital for 30 days and dying in isolation in the hospital to the same extent as they were in 2020. This is fantastic, and that is largely the result of vaccines and some better treatments and better hospital care now that we didn't have in 2020. What was the second part of the question?
The current effectiveness of vaccines, their safety, and access to boosters.
Okay, so the vaccines remain incredibly safe. They are a remarkable achievement. There were some challenges with a few of the new vaccines when they first came out. The ones that had some challenges and caused more side effects were pulled off the market. The ones that we have now remain very, very safe. And it is proven that the risk of a side effect from the vaccine is much, 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 much smaller than the risk of a side effect from a COVID infection or a long-term effect of a COVID infection. So that's true of all of the side effects that people worry about with the vaccines. As far as addressing our access to boosters, it is a rapidly changing environment. We know that there have been some changes in the CDC panel that approved vaccines. There was a vaccine that I personally love that for some reason the booster was not approved under the new administration. And we had just seen, I think it was this morning, the American Medical Association and the American Pediatric Association and a group of even more groups all signed on for a lawsuit about our access to boosters because they don't agree with the more limited access to boosters that are being pushed by the current administration. So I will say that it is a rapidly changing environment. Stay tuned. The boosters remain incredibly safe. They are keeping people from dying in large numbers, and that is fantastic.
Wow, so very current events, right, as of today, to be commented on in the news about vaccines. Okay, so I'm going to turn things to Stephanie a little bit because we've been hearing a lot of from her. And first, so Stephanie, can you address why do you think physicians have been so slow to embrace airborne transmission and its ramifications? The CDC has information on clean air and N95s and air filters on its website. We know the vaccine efficacy is 95% with the masks, for instance, as Fiona said. Why do you think it is not being implemented?
I think historically there has been a focus on fomite transmission, which is like surface touching, or those large droplets that you get from coughing or sneezing. But very little attention has been paid to those tiny particles, those aerosol particles. And we now know the most effective way to protect against those is to use air purifiers and to also wear the most protective mask that you can. But it historically has not been taught to physicians or doctors or anyone in the medical field. We've just primarily focused on those bigger droplets. But now we are understanding the science of airborne transmission through aerosols a lot better.
I see. So you're saying basically habit, right? We're saying it's habit to say wash your hands, and it's not habit yet to say wear a mask in medical settings. And so I think that's
right. And I think there's been sort of a missed opportunity to focus on the most effective prevention mode because it's great to wash your hands. Of course, wash your hands for all kinds of reasons, but washing your hands is not going to protect anyone from the airborne aspect of viruses.
Yeah. So on this note, I'm going to ask you one more question, Stephanie. What would it mean to the communities you work with if we as a society made cleaning the air a priority?
So I'm speaking for myself, and I feel like people will probably agree with me. To me, it would mean the world to me because it feels like, as a person who is high risk for any number of things, it feels like those at high risk have been told to just, take all of the precautions while the general public has been told that they'll be fine. And that's not necessarily true. So I think when we start to realize that clean air is a priority for everyone, I think it will make a huge difference whether you're considered high risk or not.
Thanks. Okay, so we've addressed that society is not addressing clean air like we do for clean water, and hopefully it will someday, right? So we're all going to work on it. So third part of the questions, and then we'll open it up to the audience. So to talk about how can we make sure we're breathing clean air ourselves in the meantime. Jose, you talked a little bit about this, but I want just every panelist to answer, what tools do you use to clean the air in your own life, right? So in what ways do you notice they improve your health, whether that's masks or the air quality monitor? Just talk a little bit more about the science behind those and what you do.
So as I think probably everybody knows already, you try to use layers. We don't have any silver bullet, but you have some layers, and you use more layers the more risky the situation is, right? So you go to an airplane, yes, they have their filters and different things, but you wear a really good mask there. If you are outdoors, maybe you don't need to have to do anything. If you're at home, well, depends. Is someone sick? Is someone high risk? Or is there a wildfire? And then you may turn on the more air cleaners or things. One thing I've been trying to do in my own home is try to do things that are going all the time, that I don't have to do them actively. So I install better filters in our air circulation system and try to keep the filters going on more of the time, so I don't have to be taking some more active measures. But if someone is sick, then we bring back the air cleaners or the masks in some cases, things like that. And as I said, I always go with the CO2 meter to explore different places.
So I think the only thing I would add to Jose's recommendation is that I've started masking outside sometimes. So if there is a lot of wildfire smoke in the area, or if the pollen count is really high, I used to really suffer from environmental allergies when I was outside and doing yard work and things. And I've started masking when I'm weed whacking. I can weed whack all the ragweed to my heart's content without suffering, without turning into one or three of Snow White's seven dwarfs, Grumpy, Dopey, and Sneezy. And so masking in those situations, and I just want to add symptom screening and air monitoring. So tools like IQ Air and Purple Air are some of my favorite tools to monitor the air quality outside. And symptom screening, so if I know someone around me is coughing or sneezing a lot, I will just ask them, hey, are you sick? Should I mask? And that is something that, or should we gather? Should we not gather? And that helps as well.
I would second everything you said. I was thinking more about biosystems, about smoke. So something else we're learning all the time. Like, for example, something we're learning recently is actually there are some mycobacteria related to tuberculosis in the soil. So I was listening to some scientists that were saying you need to mask when you're working on your yard. It's like, what? Like, we'll be working on. So then we were talking about it. It's like, okay, it's really when you're digging the soil and when you're mobilizing the soil, and that's something I'm going to start doing that I wasn't doing before.
Well, I just learned something new. Maybe I'll start doing that too. Yeah, I love these answers. I want to hear from Stephanie. What tools do you use in your own life? What sort of, how do you notice it improves your health as well?
So I mask whenever I'm around another person, inside, outside, doesn't matter. I frequently mask inside my home because I rely on the help of certified nursing assistants so that I can live independently. So in my home, it's like a rule that they mask. So if I ever have to take mine off, then at least I have that one-way protection. I also use air purifiers quite a lot, especially if there's more than a couple of people in my house. And I'll open those windows when the air quality is good. And I have not been sick since I started taking those viral precautions like masking and opening windows and things like that. So
That's amazing. Okay. Yeah, actually, maybe we've talked about like almost everybody has mentioned these air quality monitors. Can you turn around your AirNet here? So maybe I'll put mine up to the screen as well. So this kind of air quality monitor can tell you the concentration of carbon dioxide in the air, right? And that tells you sort of how much of other people's breath you're rebreathing. And can you actually just tell me what cutoff you use to, like you said, as it goes up to what, 1,000? Like what do you consider dangerous?
So actually, I would say that it depends on how much time you're going to. Oh, sorry.
Yeah.
It depends how much time you're going to spend, and especially depends on whether people are talking loudly. If you go in a room where people are silent, that's the single most important factor is the level of speech. If people are talking loudly or in a choir or something like that, that's very dangerous because they're putting a lot of aerosols in the air. If you go to a place where people are very quiet in a library, maybe so I would say I filter it with those factors. So an airplane, yeah, they have a lot of air changes, but it's a very small tube where you are there with a lot of people for a long time. So that I always put mask. If I go to a concert or a bar or whatever, then I may put my mask on at 800. If I go to a library, it really will have to get to 2,000 or something for me to be concerned. A place that people are very quiet.
Great. Cool, thanks. Yeah, so basically the higher the number, the worse is what we want to say, right? Definitely. Okay, yeah. So, yeah, an outdoor air is what, like 400, 500, something like that? Okay, just to make sure we're on the same page here. One more question for Jose. What's the difference between air filtration and ventilation? Because I think that's like words that people mix up a lot.
Yeah, ventilation is when you get air from outside. So there is a virus or a pollutant in the air, and it goes away because there is new air that doesn't have it that's coming in, and the air that has it is going out. So that's ventilation. Filtration is the air is staying put, but you are removing the virus or the pollutant by making it go through a filter, which is like a fan that has a mask, basically. That's all filtration is. There is a third type of thing, which is what's called air disinfection, which is, for example, which is basically and it's applied for viruses and things like that. You leave the virus in the air; it's still floating. You're still breathing it in, but you have killed it. So you have put some UV lights or some other means, and then that virus, even though you're still breathing it in and still depositing in your lungs, it no longer makes you sick because it's no longer infective. So those three things are the three things we can do.
Okay, so one more question for Stephanie, and then I want to look at the tools here. So Stephanie, have you, oh, you mentioned your nursing assistants coming in to mask and everything, but in some medical settings, people aren't masking. Have you experienced any barriers trying to ensure that you have clean air to breathe in situations where you're, say, unable to mask? How did you overcome them, or what do you recommend people do to advocate for themselves when they need to avoid hitting those barriers?
That's a situation where it sounds strange to say, but I kind of feel fortunate that I have an obvious disability because people assume that I am high risk. And so even though they might not want to mask or turn on that air purifier, certain assumptions kind of work in my favor in those circumstances. And if the person is not wanting to mask, I still ask and explain that I am high risk, and then I'm trying to protect both of us. And then at that point, it's up to the other people. But at least I know that I've done all I can to stand up for my health and safety, and that's just what I would, advocate for other people to do for themselves. As hard as that is to do sometimes, but it's really necessary.
Sense. Okay, so I'm going to sort of demonstrate all the tools we have here because we've talked a lot about them, and I can turn this around for the people on Zoom. We have, hang on, let me put this up a little bit. Okay, so we have our tools demonstrator here. If you want to just hold things up, this is a air filter that you can put in your home. There's a lot of little round, quiet air filters made by Levoit. This will filter out, wildfire smoke and things like this. What else do we have here? UV lights, right? So Jose just mentioned UV lights. These are possibilities. We can put a whole list of these online after the event, and I email them out. There's lots of different options. Here we have lots of types of masks. So in terms of masks, there's N95s and KN95s here that people can take a look at. There are Zimmy masks, yes, lots of air respirators, lots of different things for different types of toxins to filter out. Even if you want to go to the dentist, you can filter out the air that's going into your nose using a dental mask. And we have other air filters over there. This is called a powered air purifying respirator. And do you want to say anything about that? No.
This is great. This is great for people who can't get a good fit in a mask or need to be able to eat or drink in an unsafe environment.
Okay, yeah. So this is basically just pumps clean air right into your face, right? So your own personal air cleaning device that you can carry around. So there's tons and tons and tons of clean air tools available, and we wanted to just sort of show all of those before the end. So Misha just said we are using ventilation, filtration, and UV in this room. UV is another sort of virus killing technology, and so it's something you can look into as well. Okay, so this is, that's the summary of all that we've learned today. I just want to see if there's any closing remarks from the panelists. So let's have Jose start. Any final remarks? Any message you want the audience to take away from this?
Maybe I think we've already been saying the same thing, but I mean, for me, and I think for most people in society, is this idea of layering and being alert and using things when you need them, but not necessarily all the time.
I wanted to point out to everybody that July is when we celebrate Disability Pride Month. We celebrate the inherent worth of people with disabilities, and we realize that disability is not a negative necessarily, but it just adds to diversity. And I just wanted to point out people with disabilities are at higher risk, but that doesn't mean that there's no risk for everybody else, right? So, as proud as I am to have a disability and be who I am, I still want everybody, whether they have a disability or not, to take all the precautions that they can, because there's no need to join the disability community if you don't have to.
That's a great message.
Yes, I love that.
Yeah.
I hate that I have to follow that. But I'll just say that public health has always been political. It's always political when you tell people what they should and shouldn't do with their bodies. What they should and shouldn't do with their bodies. It's always been political. But that means that we have a voice. And so you can call your senators, you can call your representatives. We are lucky that in Colorado that we have a legislative body that is willing to fight for our rights to access vaccines. So please advocate as much as you can and vote responsibly.
Okay, thanks. So I'm going to open this up to questions from the audience. Go ahead.
I've read that the administration is now trying to remove preservatives from the vaccines. Will that make them ineffective, or do we have to check to see that they're current? How long can they last without preservatives?
So I cannot pretend to be an expert in vaccine lifespan, but I will say that the conversation around vaccine preservatives is very political and very tied to some misinformation around vaccine safety. I do know that the COVID vaccines, for example, will last for a long time in a deep freezer, and that is how most vaccines are stored until they are shipped to your doctor's office. And I think we are we are in a reality where worrying about preservatives and vaccines should not be as big of a worry for us as ongoing access to the vaccines we need to stay healthy. Thank you. Sorry.
Okay, there's some questions on the chat, and I just somehow made the chat full screen, and I don't know why it became full screen here, but we'll just deal with it. So there was a question, I'm just going to read it aloud. Current grad student and clean air activist and I often struggle with conversations with academics about clean air precautions because, quote, they don't care about COVID anymore. This is Veronica Hanway. How do you engage in conversations with academics about clean air to help educational spaces safer for BIPOC and disabled students, faculty, and staff? That's a great question. I'm an academic too. I want to know the answer to this. Any any academics besides myself want to talk about this, or any people want to talk about this? It's open to any panelists. I would love to hear how people weigh in. Go ahead.
I will only say that I don't know. I mean, it is sociology, or and people are very fatigued from the pandemic, and it's very difficult. I mean, even with close colleagues or with my family, I struggle to get them to care. So I don't. I mean, I know there are ways, but it's just a big challenge, I think.
So I agree completely. It is a very difficult thing to get people to care about something. But I will suggest was it
Veronica?
Veronica?
Yeah.
To look into something called the health belief model. That is my personal favorite public health model that talks about how you change behavior in others or encourage others to change their own behavior. And it's about connecting with people and making small improvements over time. So that is how we are now in a world where people are taking PrEP if they are sexually active with multiple partners and not getting sick with HIV and having it turn into AIDS. That didn't happen overnight. It was several conversations and years of work and years of encouraging that and communicating about your emotions and meeting people where they are and moving them a little bit each step of the way. But the health belief model is an excellent tool that gives you a lot of ideas on how to accomplish that. And if you can think through that for air quality, that is what I would suggest.
Excellent.
Thanks, Fiona. Yeah, I mean, I almost want to comment on this myself, just as an academic who has had these conversations. I do encourage my students to mask in my classroom. Just doing those little things can sort of help set the example that it's not a weird thing, right? I mean, things like that, me masking means that all my grad students mask. I mean, they sort of, people follow each other. And so you can set a good example just by doing what you think is right yourself. We're in a democracy. This is how this works, right? At least for now. So anyway, let's see. Stephanie, did you have any comments on this?
So actually, yeah, I might be one of the most COVID cautious people in the universe. And I don't mean that like conceited. I'm just very, very cautious because I am high risk. And I'm noticing that the more I continue to take precautions and sort of inform people around me, I just recently had a CNA tell me that she heard on NPR something that I had just told her the day before. So now she is um, borrowing my masks anytime she goes on a trip. So that is just like a small positive step. I would just say be consistent, and you can't make others believe you or believe the evidence, but you can keep doing what you know as is right, and you can share that information, and they may or may not come around.
What is your opinion on ASHRAE standard 241? I don't know what that question means. The question is, what is your opinion of ASHRAE standard 241? Do you know this? Oh, excellent. Okay.
So ASHRAE is the American Society of Heating, Ventilation, and Air Conditioning Engineers, and they are the body that sets the ventilation standards. So for example, they say, okay, meeting room in an apartment building has to have this many air changes per hour, and a classroom this much, and a hospital this much. And those standards are not mandatory, but often the states or the federal government adopt them because they come from the experts. So coming out of the pandemic, they decided to try to create this 241, which is a standard of what do we need to do during periods like the pandemic? If we have another pandemic, how much cleaner do we need? And there was a committee of people of which I know a bunch, and they came up with some answers that, like anything, some people think it should be higher, some people think it's too much, but they are pretty good. I mean, if we had that standard implemented throughout society, we would be in a much better place than we are. The problems right now is that that standard is not necessarily being adopted, right? This building or my classrooms or whatever are not being changed to comply with that standard right now. Maybe in some places, maybe in some new buildings, but there is not an urgency, and actually society is going in the opposite direction right now. But it is there, and it is positive, and it may take a while for.
I'll say this is another opportunity for advocacy. I know the folks at CDPHE who work in indoor air quality would love to move from the standard in schools being MERV 8 filters to MERV 13 or 16, which would comply with ASHRAE 241. It just takes time, and it takes a lot of work to get all of the people on board to make these changes. Changing building codes and adopting building codes is really, really, really difficult. It takes a lot of political work, and so keep at. I think it's a good standard. I think it will keep people healthy. I think we will still have periods where we will need masks despite that. But I also think it's good that it exists.
Thanks. So basically, to summarize that, you're saying, we can go to our public school and say, hey, look at this ASHRAE standard. Are you up to code? And encourage them to clean their air, and because schools definitely need clean air, right? Okay. Yeah, any other questions from the in-person audience? Any thoughts? Go ahead, Susan.
I think I read a couple of years ago that a good air purifier could make a big difference in a classroom in terms of a reduction in viral transmission. Is that true?
Sure. Susan's question was, does good air filtration in schools reduce transmission of disease in schools? And I will say that it not only reduces transmission of disease, it reduces absenteeism overall from disease, asthma attacks, and other issues that children and staff can experience at schools. So multiple proven studies, 40% reduction, I think, in Italy, and 50% reduction in Finland. I'm fudging that one, I apologize. Multiple repeated studies that have demonstrated significant reduction in absences and illness in children if you have good filtration in schools.
And can you get that from a portable air purification? I'm sorry.
So Susan's follow-up question was, can you get that from a portable air filter? And the answer is yes, a big enough one. The smallest one that I brought would not do that, but this beautiful one behind me absolutely would. So I don't know if anyone can see this. This is this the Nukit Tempest?
Yes.
This is a wonderful, lovely, quiet, fabulous air filter.
Yeah.
Totally agreed. I would add one thing doing with the schools, that air filters are great, but during the pandemic and even now, there is a number of companies that were selling other types of air cleaners, some of which don't work, some of which actually do damage. And then they were convincing the schools to reduce the amount of ventilation because now they have this ionized aerosol thing. And I was part of a group of scientists who was, one of us was sued and the rest of us was subpoenaed by one of these manufacturers and whatever. And it's a little bit of a jungle out there. And the best we can do is to get the information out. Filters good, ventilation good, avoid most other things.
Yeah, so right, I like all these answers. I mean, it's amazing how much clean air can help us, right? I think that's the real takeaway from this panel. There was one more question in the chat that maybe Stephanie can answer. At the end here, I think Veronica asked again another question here. Do you have any words of hope or encouragement for those who are still isolating as public spaces aren't accessible due to lack of clean air? So, yeah, I don't know, or anybody of the other panelists, but Stephanie, if you want to address that.
Wow, that one hit home because I stayed isolated for quite some time and sort of had trouble getting back out there just mentally. I've been where you are. There are people who support you and who are being safe with you. Anybody who is still isolating will never be forgotten by me and millions of other high-risk people. So I know how lonely that can feel, but I hope you know you're not alone. And I don't know if that helps, but I hope it does.
Thank you so much. So it's really nice to hear that clean air is also an accessibility issue, right? And it's important for a lot of people. Like it's an essential tool for a lot of people to just access basic needs. So okay, so I think we can wrap up here. We had our final words. We had our questions. Thank you everybody for coming. For the in-person people, we have this whole tools table over here. You can definitely check out what we have. Take a sticker over there. We have Mask Together Colorado stickers. And we have like brochures and pamphlets and books and things you can take if you'd like. We're gonna have, I can send out an email to all the registered participants here with all the brochures and pamphlets we're handing out here as well. And this was a recorded thing. We're just going to clip the segments and put these online at some point for everybody to send them out or access them. So thank you for everybody who came and participated. And this was very fun. So thank you to our panelists. Let's give a round of applause to our panelists. And I think we should wrap up, right? Okay, thank you.
Thank you for organizing.
Thank you, guys.
Thank you.